The topic, the through line, as I like to call it, is from pixels to patients. And it's destiny kind of thing because at the last conference we were talking about this, like, how can you empower patients to drive digital pathology? Is there a place to do it even in the like quite litigious country, litigious uh, area of life, which is medicine and medical liability? Can you?
Yeah.
Obviously, yeah, you want to, but to which extent? How, like, what role does it play? So this is the topic of the conference, the path visions. So yeah, any insights that you have gotten from today's talks, today's conversations?
This year, there's definitely a change in the dialogue from worrying about what the cool, exciting, like far out bits and pieces that you can eventually do with digital pathology are. This year, we're focusing on examples, case studies. How do you stop making mistakes? Sim is in here and sort of going, we there are lessons that pathologists can learn from radiology, to reach out and do things. So I think pixels to patients essentially means let's focus on what we want to do with digital pathology, which is improve patient care. But now we're looking at, in terms of the topics of the conversations, it's how do we directly do that today rather than 10, 15 years time. So
yes, very much. And I see a couple of, so one presentation that I kind of got in private because I missed several because I came late again, like in all seriousness, one company have presenter, and I'm kind of like, and you analyze them, right? My like outside perspective, they are not even my sponsor, but I see like what they're doing. And by my sponsor, I mean the sponsor on Digital Pathology Place. I like see the pace that they're going at. It's very fast paced. And like what they were presenting today, and Dr. Raj Singh was showing me the slides that I missed in the official presentation, was how basically they empower everybody who wants to take advantage of digital pathology for patient care to do it at no initial cost, which is like a big part of the discussion because I don't know, even a couple of years ago it was like, okay, such a big investment, such a cost center, and now people are figuring out the way to make it profitable,
lowers the barrier to entry, makes it as easier, so that they can just sort of hop on and use it for free. And I think they have an impressive number of users as well. I don't know.
Oh my goodness, 70,000 people,
75,000
people are using Path Presenter in one way or another. 62 institutions that are using their like official paid version. Yes, and I am a user as well for the educational content. Like whenever I like teach histology or anything, Path Presenter is my go-to platform. It's just easy to use. You log in and like.
And I don't know whether Raj mentioned, but they were talking about like an end-to-end workflow again, where they were trying to get more patients involved in clinical trials as well, which we talked about last time. You approach the aperture, and it's nice to see because vendors are now sort of not waiting for reimbursement; they're helping their customers sort of turn pathology into more of a profit center rather than a cost center, which keeps it relevant.
Very much.
Especially as it's coming into this bigger digitized world.
Yes, so he showed like, and obviously we're talking about a specific presentation from a specific vendor, but each of these presentations is a representation of a trend that is going on. And in the like previous episode, we were mentioning other vendors that are doing something similar. So he mentioned three like areas where they are doing it. One is consultations. So consultations, so the barrier to entry, you mentioned lowering barrier to entry, is very much with consultations because this is not in the primary workflow. It's something additional that you as a healthcare provider can charge for. And if you have a setup for this, then basically everybody who does not have a setup can tap into your setup.
Yeah.
That's on the software level. And they partnered with a scanning company, Grandium, which like I just went to their booth. You need to go because they have like 4 little grandies.